Hearing loss is actually an important medical condition. It's not just an inconvenience, and it's not just humorous when you mishear and think someone said something different than what they actually intended. There's very clear data now, particularly in large studies, that show that untreated hearing loss is actually a risk factor for dementia and other cognitive disorders. And this makes sense if you think about it. The way most of us lose hearing is we tend to lose hearing at the high tones. High tones give us consonant sounds. Low tones give us vowel sounds. If you still hear the vowels but don't hear the consonants, you can't tell the difference between hat, bat, cat, and rat. Imagine a conversation when you mistook the word hat for rat. It could cause some confusion and maybe a little bit of excitement, and it could be a little bit funny for a while. But once this starts happening, people start getting a little bit confused in terms of what the conversation is about. The patient themselves may get frustrated, and worse yet, the family gets frustrated. At that point, it's not very hard to imagine that someone can become isolated or even depressed over this. Other things that hearing loss can cause, in addition to initiating this confusion and this isolation, it actually turns out that untreated hearing loss is a risk factor for falls and imbalance. And even though we don't work quite like bats that can use their listening to guide them around in the dark, we do rely on hearing to help us in terms of understanding the threats around. Many years ago, when people had hearing loss and didn't want to do anything about it and weren't interested in hearing aids or other devices to help them, we considered it an elective personal decision. Now, it's really a medical decision. Not treating hearing loss, particularly in the elderly, puts them at higher risk for cognitive decline, dementia, even isolation, depression, and even balance disorders. So we pretty strongly recommend that if you've got hearing loss or you suspect an elderly person in your family has hearing loss, they should be evaluated and at least go through a trial and an evaluation of some of the treatment strategies that are now available.